today on a special discussion of arthritis with Sandra and YATHRA Ayurveda. Very important topic, which is arthritis, and this is something that will cause a lot of pain and discomfort, and we thought we will have some knowledge about arthritis and get a little discussion with Dr. Sarvangi here and talk about how arthritis or the different forms of arthritis or the different pains that everyone's going through, what remedies we can come with, what treatments we can come with, and the expertise or the expert of these treatments and to give us a little bit more knowledge about what to do and how to stay away with different things. I think we are the best option, the best person we have on board in YATHRA is Dr. Sarvangi. What is really arthritis and what arthritis disease is all about?
Arthritis is, in simple words, is inflammation of joints and causing pain and lot of stiffness in joints. The joints can be either wrist joints, any smaller joints, or bigger joints like knee joint or ankle joints, and lower towards the lower part of leg, that is feet joints. It can be anywhere. So arthritis is a Vathic disorder. In Ayurveda, it's a Vata that is main cause of arthritis due to imbalance of dosha, that is biological energies. Dosha is biological energy, and also due to ama, that is toxins, it causes the arthritis.
I think I need a bit of more explanation because it's a bit a strong line for me when you say that toxin. So where does this toxins come from in certain people's body, or where does this imbalance happen? How does it happen?
The oily food we eat and then going for exercises is the main cause of rheumatoid arthritis, also known as reactive arthritis, and in Ayurveda it is termed as ama-vata. So as you said, where does these toxins come from? So ama is nothing but toxins. So when we eat this too much junk food, carbonated food, and frozen food, it is accumulated in our stomach, it is not digested properly, so the undigested food remains in the body as it is without digestion. That is nothing but toxins and ama.
That's very important for all the viewers to know, because their question was where arthritis came from, and now next question is, doctor, to you would be, what are the different forms of arthritis, which I think you just mentioned to me earlier, and how these forms are formed? I mean, what are the levels of it?
Arthritis is, as I said, inflammation of joints. But again, there are many types of arthritis. Some are genetic arthritis, some are age-related arthritis, some are food-causing arthritis. Now you would be like, what are these different types of arthritis then? So coming to age-related arthritis, so when a person comes to the clinic, we do consultation. So for arthritis, consultation is necessary because while doing consultation, we have several questions. So when we come for arthritis, we need to note that we need to note patient's age, patient's health, lifestyle, dietary, everything, all these causes, and also arthritis associated with other medical conditions. We all need to make concern about these things. We need to consider, it's very important. So age-related arthritis is osteoarthritis, which is mostly seen in old-aged people. They suffer from stiffness of joints, then also pain, swelling. So this is one type of arthritis, that is osteoarthritis. Coming to rheumatoid arthritis, it is caused due to food. As I told you, ama-vata is rheumatoid arthritis,
Which is a reactive arthritis.
Reactive arthritis.
So that is caused
also
mostly due to food.
It is caused due to food, and also sometimes it is seen that reactive arthritis is caused due to infection in other parts of the body, such as intestine, genitals, urinary tract. When these are infected, there is infection, which again causes swelling of joints, paining joints.
So these infections can trigger the swelling
and
in the
pain
joint,
in joints.
in the joints, or maybe a shoulder or
Yes,
any joints,
any joint.
and can bring out this reactive arthritis. And doctor, this reactive arthritis is something that normally travels, I believe, from one joint to another,
Yes.
and causing a swelling and inflammation and redness, and it causes
Yes.
a lot of pain that sometimes it's unbearable. So what do you have to say about this, doctor?
The infection can also spread to, if there is severe condition, the case is very severe, then it may spread to eyes, skin, and other parts of the body. So coming to eyes, the infection spreads to eyes, then it may cause conjunctivitis, cataract, and may worsen the severity. And even coming to skin, it may cause rashes, then redness and inflammation. So it's a very severe disorder or disease, and it is also called as Arthritis syndrome.
Can this Ayurveda cure completely someone?
The answer would be no, Sandra, because Ayurveda has got treatment which take time to show the improvement. So after consultation, we come to know how severity the condition is, how arthritis and how it is associated with other diseases. So after that, we decide the medicines, home remedies, even exercises, followed by the Ayurvedic therapies. And all this will take a period of weeks, months, and if the severity is more, it even take years as well. So we cannot confirm that immediately you come, take a treatment and you get cured. No, you need to take multiple sessions followed by internal medicine, and also dietary changes, lifestyle modifications. This all together will help you to improve your condition and help you managing the disease.
One person asking me questions, he was saying there are genetic arthritis, there is viral arthritis, and there is reactive arthritis. Among these three, which one is the worst one for someone to even have?
I cannot say what is the worst among these three, because again it comes to the person's habits, age, and also associated disorder. If the person is very young and he has got arthritis, initially it is diagnosed, and also his lifestyle is good, he is able to improve the diet and also taking internal medicines constantly for long period with therapies, then it is going to show the improvement very quickly. But the people with the arthritis for more than 10 years, 15 years, along with other diseases like diabetes and hypertension, blood pressure, and many more diseases, then it's very difficult to bring the improvement in a clinic or any other places you visit. Yeah, but I will definitely take a guarantee of that thing, that if the person is having good lifestyle, having proper diet which is given by the physician, consultant, and also taking herbal medicines, herbal therapies, then improvement is going to be seen very quickly.
I think 90% of YATHRA's clients are based on arthritis issues and arthritis clients. What would be the procedures that you would start off with an arthritis client? What are the different procedures that arthritis patient is going to be doing when they consult you?
Then I need to consider his age first, his health, associated diseases, his lifestyle, his even diet, everything I need to consider. Then if the arthritis is due to infection like reactive arthritis, then immediately we can't start treating arthritis because the main cause of trigger is infection. So I would suggest him to first treat the infection, and Ayurveda has got turmeric which is anti-inflammatory. So I would suggest the client or patient to have half a teaspoon of turmeric, mix it with warm water, have it daily. It's anti-inflammatory.
So you are trying to say first step for that reactive arthritis client, because of his infections and the spread that he's going to get, is to have a balance of what he eats and cure that internally rather than externally by taking the Ayurveda most like spices which is found in your home.
Yes.
For example, ginger, I guess, turmeric, coriander, garlic. So these are the ones that kills off inflammatory infections, inflammation, and like garlic acts as an antibiotic in your body. So these are the healing, powerful spices in your kitchen, which you can take and do at the start. So you're going to recommend their diet plan first, then you will do a treatment plan for them to take sessions of different treatments like Shirodhara, Abhyanga, and which other ones would you recommend, doctor, for an arthritis patient?
Yes, Sandra. Also, Abhyanga and Kisi are very good for arthritis, no doubt about it. But Amavata, that is rheumatoid arthritis, the main cause is ama, and ama increases if we give oil.
I'm sorry, you said ama increases if you give oil. So what do you mean to say when you give oil?
Oil or ghee, any snehana, that is unctuous substances, if you put on the joints which are very painful, which are having swelling, stiffness, the condition is going to aggravate, especially in rheumatoid arthritis.
Oh, doctor, you're saying when someone has rheumatoid arthritis, for example, the reactive arthritis,
Yes.
so when they do an abhyanga with the oil, that will increase his pain?
Yes.
So what would be your treatment? What treatment is best suited for that particular patient?
Yes. So I would suggest, rather than going for abhyanga or snehana, I would suggest rukshana.
And what does Rukshana mean? I think that for me that sounds like a girl's name.
Rukshana is nothing but drying therapy.
Okay.
So we do lepana of rukshan dravya. One of the example is kola kulatali churna. It's very ruksha, very dry, and lepana of that thing on your joints is going to help you in pain relief, stiffness, everything. Once that ama toxin is gone, then you can treat abhyanga and kesi.
So Dr. Sarvangi just suggested the remedy for rheumatoid arthritis, which is a reactive arthritis. She said, first detoxifying yourself, cleansing yourself, and then eventually she says you can take abhyanga, which is a full body massage with oil, or a light oil session, not a complete full oil session, where it will give a relief to the joints and to the pain and reduce inflammation.
Yes.
And then to top it off, or to even start off with, is the Kodikizi, which is this herbal pouch that you have, doctor.
Yes.
So this herbal pouch will, when you dab it or stamp it on the body, it will take off the pain and reduce inflammation of that particular joint.
Yes.
So this is your therapy, or this is your treatments for anyone with a severe arthritis. Is that what you're saying, doctor?
So when the client or patient comes to me with a complaint like joint pain, stiffness, and not swelling, joint pain, stiffness in any part of the body, either back or lower joints or smaller joints, anywhere, then I would suggest the abhyanga with kisi is going to work very nicely, because abhyanga is like application of oil on full body and with a light gentle massage. That's the Ayurvedic traditional way of massaging. And then comes the kisi. So this kisi, we put some Ayurvedic herbs, and according to the patient's needs, according to the conditions, we mix different kinds of Ayurvedic herbs and YATHRA's formulations that we put into it, and we make different bodies for different treatments and for different patients. So it's not one potly or one herb, it is a mixture of formulations of which is created by YATHRA, and then we tap it on patient's body, and the mechanism of heat and the warm oil which penetrates into the joints and causes helps in improvement of flexibility, improvement in the pain relief, and also the stiffness, and the motion of joints becomes good. Because in simple words, I can give you practical example. When the door is stuck, the hinges are stuck, what do? We do lubrication.
Yes.
That is jointness of hinges rubbing to each other, and what do? Is put oil into doors and make it lubricate. Doesn't make sound. Similar is with our body. In osteoarthritis, the cartilaginous bone, that is ends of the bone, loses its elasticity, and they rub with each other and causes noises and causes stiffness. So Abhyanga, that is putting of this Ayurvedic herbal oils to it, is nothing but lubrication.
People in this country, and because of the cold, are going through a lot of severe pains, and because the cold is kind of attacking them in a way. Doctor, I just want to understand, how does the cold attack them, or the patients with arthritis? Why does the cold attack them and they always have more pains?
So the main dosha involved here is Vata dosha, and the quality, that is guna, quality of Vata dosha is Shita guna, and it keeps on moving in your body. Its nature is like that. Vata dosha's nature is like that. So in winter, the temperature outside is very cold, and the arthritis patient are suffering due to Vata imbalance.
Doctor, can I stop you there? Vata is what exactly in that body?
It's a dosha.
Heat? Is it the heat?
No, it's not a heat.
It's imbalance of
It's a dosha.
movement.
That is a dosha, one type of dosha.
Okay.
As in Ayurveda, we have Vata, Pitta, and Kapha. Yes. So Vata, when it's predominant in your body and it circulates in the body and it locates in one of the joints and then causes the pain in that joint. So when the Vata dosha, as I said, quality is cold. So when the outside temperature is very cold, Vata is located in that joint, it triggers Vata dosha to become more predominant, and then it gives the symptoms of arthritis in severe conditions. So the patients will have lot of pain, lot of stiffness. So then they would go for opposite quality, that is heat, pitta. So when they go to warm countries, they feel good because heat is going to reduce Vata.
Yeah.
So eventually when Vata is reduced, then they are going to feel better. So even taking opposite to Vata dosha food, that is garlic, then ginger, turmeric, eating all those things will reduce Vata in your body and give you very good relief in arthritis.
If a client calls you today and says, I have a lot of pains in my body and I'm suffering from genetic arthritis, what would be your first line to them?
So yes, Sandra, genetic arthritis. So genetic itself means genes. So sometimes evidence has said that rheumatoid arthritis can be passed from genes, that is the parents can pass to the children. So the parents suffering from rheumatoid arthritis, then children might have rheumatoid arthritis from birth itself or may be diagnosed in later ages. But these are the evidences which have proven that the genetic arthritis is passed through genes.
From the genes to
Yeah.
the children.
It is not definitely not 100% sure that it will be passed to your children, but there are some evidences.
Some symptoms
Yes.
can be passed on. Now, doctor, when the parents are looking at this our discussion and thinking, oh, we have arthritis, we have rheumatoid arthritis, and are our kids going to get it? Now, what is the measure that you will take to control this? in that family, what would you suggest? What's your control that you're going to work out with that family?
Yes, yes. So coming to the measures, prevention, precautions to be taken by the patients are, firstly, when they come to me, I would help them to improve their diet, their lifestyle, the things to be avoided in food such as junk food, carbohydrated foods, even frozen canned foods.
Yes.
These all foods to be avoided in their routine lifestyle.
Yes.
Also they need to exercise daily, perform yogas, asanas, pranayamas. These all lifestyle modification, dietary changes will help to limit the pain and inflammation of the joints. So some way we are taking precautions and prevention for creating like prevention of further severity.
Yes. So parents out there who are concerned about their children, if you're suffering from arthritis or anything with regards to rheumatoid arthritis, I think it starts from you, from your home, where you need to, have cooked food, home cooked food with proper balanced food. Stay away from junk food for your kids, because that's what the kids like nowadays. Stay away from the carbonated drinks like sodas and different carbonated drinks, sugary drinks. Stay away from so much of sugar out there. Lead them to a very, very nice lifestyle of doing exercise, playing a sport, going out for walks, going to the parks, and these are the measures that I think if every parent does this for their children, I think there will be a very healthy way of families coming in soon. And I think this is what we need to educate our kids as well, because they don't know. If we tell them and let them know that these are the different issues that you will face, then I think kids are very much understanding. They get the crux of what is wrong and what is right, but if you explain to them in a nice way about the healthy living, I'm sure it's all in your hands, parents.
Yes, Sandra, I guess we have covered all the points, measures, preventions and treatments for arthritis. So now audience, it's up to you. You can contact us at any time to the YATHRA Ayurveda clinic. Just call us, contact us, and you can get a consultation from us. I will give you a proper diet plan. We will also give you proper treatment plan and how to manage your diseases, how to manage your symptoms, and give you a better lifestyle, better diet, so that you can live a healthy life. Please contact YATHRA Ayurveda clinic. We hope you to see you soon and hope you to call back us. Thank you so much. Thank you, Sandra.
Thank you, Dr. Sarvangi. I think this was a very important discussion that we just covered. And you being on the hot seat on this couch with the podikisi on your side and the different oils that relieve the arthritis. Yes, it was a great one, and thank you all for watching and writing to us and giving us more and more ideas to do different discussions here. We are always here to help you with any sort of issues that you want us to address to you. If you have any more discussions that you want us to talk and come back to you, we are always happy to come back to you. We have in our following videos, we have discussions about diabetics, discussions about hair, discussions about Shirodhara coming up soon. So please watch and await for these videos, and please comment and like and subscribe us so that we can get you more and more information and spread the word throughout the world, everywhere, because I do have so many viewers watching from different parts of the world. It's not just the UK, from different continents. They are writing. We recently also had a comment from one of the patients from abroad asking us so many questions, and Dr. Sarvangi just said to me she had international consultation done as well and prescribed medicines. So she also does the medicine issues sorted out as well for any client, any patient that needs some sort of help. Thank you very much again, and we will come back to you soon. Thank you.